Hi, I'm Amanda Van Wagner. I am with Parkview. I'm the manager of workplace wellness. A little bit about me before we get started with this presentation. We are going to be talking about cardiovascular disease, heart health today, and I actually have been in the health and wellness industry for just about 15 years. I've been with Parkview for just about 7. And we're going to talk a lot today, diving into cholesterol, what causes heart health, what is heart health. um, I have a big passion for this, so super excited to teach you guys and just kind of go through what all of this is. So cardiovascular disease, also known as CVD, is the #1 killer in the United States. It is responsible for 1 in 4 deaths in the United States, and which is more than all forms of cancer combined. About every 25 seconds, an American will have a coronary event. So that is going to be your heart attack, your stroke, think of your high blood pressure, and we're going to dive into all of that today. Over 800,000 people die in the US each year from cardiovascular diseases and strokes. And in 2010, an estimated 785,000 Americans had a new coronary attack or a reoccurrent attack, which is quite a bit. So I kind of like always want to stop everybody here at this point and just kind of say, like, think about how many people do you know that have had any type of heart disease, a stroke, high blood pressure. All of that can tie into heart attack. I know there's been several people, I know you guys came off of, having wellness screenings, several people that have high blood pressure or high cholesterol, that in turn from that screening can actually go to their physician and find out that they have some blockage and whatnot. So there's a lot of people out there. You may know someone, you may not know someone, but at some point in your life, you will know someone that has that cardiovascular disease. So what are some common types of this cardiovascular disease? You have your myocardial infraction, which is your heart attack, your stroke, which attacks the brain, and then the coronary heart disease, the high blood pressure that you get from that. So we're going to dive into all of those different areas here. So coronary heart disease. That occurs when a substance called plaque builds up in the arteries that supply blood to your heart. So you will hear me talk about this a lot throughout this presentation. I always explain that plaque buildup that goes to your heart. Think of a straw, and that plaque actually can build up on that straw. So if you have on the inside of that straw, so if you have a lot of plaque buildup in that artery, it is going to be much, much harder for that blood to flow through the artery to get to your heart. So same thing if in a straw, you're drinking a smoothie through a straw, and if you have a lot of plaque build up on the inside of that artery wall, it's going to be much harder for that smoothie to get through that straw. So think about that plaque buildup in a straw when we kind of talk about this. So that plaque is made up of cholesterol deposits, and we're going to talk a lot about this as well as we get going. But those cholesterol deposits can actually build up, and that's what's causing those bigger chunks of that plaque buildup in your artery. And that develops over time. So again, you have that straw, and that builds up, and that's actually narrowing down the arteries. So think of that blood flowing to get to that heart. You don't want that plaque there, because that's when you hear people that have those blood clots in those hearts or that plaque buildup in your heart. That's what this is coming from. So this picture is a perfect example of what that looks like. Top left, you have a normal cut of your artery section. Top right, you have that little tear in your artery wall. On the bottom, you can actually see where you have those fatty deposits built up in that artery wall. And then on the bottom right, you have that narrowed artery wall where you have where it becomes blocked and you have that blood clot. So this is a perfect example when you can think of, someone that if you yourself or someone that you know has, those blood clots, in the arteries or the heart attack, this is essentially what it's looking like. And this is what your arteries break down and look like. we are going to talk about your cholesterol and what that does. So when we get to talk about the LDL cholesterol, I want you to think back to this picture. That yellow, the fatty deposits in there, that's going to come from the LDL cholesterol. And we're going to dive in and we're going to talk a lot about that here in a little bit. So top is kind of what you want that blood flow to look like. Bottom is what you want to try to eliminate. And there are ways that we can do this, and we'll get into that too. Myocardial infraction, which is called your heart attack. So that happens when a section of your heart muscle dies or it gets damaged because of reduced blood supply. So if you go back to that picture that we just showed, and it had very, very little room for your blood to flow through those arteries, that damages those arteries because of that lack of blood supply and can cause a heart attack. Your coronary artery disease, CAD, is the main cause of a heart attack. A less common cause is a severe spasm of the coronary artery, which that can also cause and prevent blood supply from reaching the heart. So that heart attack is the probably the number one thing when you have those clogged arteries because that blood flow is not getting through. So here's kind of another picture too, where you can see the dying muscle in the heart. On the left side, you have, a healthy muscle, and on the right side, you have that dying muscle. So if you look at the breakdown just a little bit further, that dying muscle has that blood clot, and it has that cholesterol plaque in there. So that's what's causing that flow to get through, to not be able to get through. So then let's also talk about another form of your heart disease, which is your stroke, that brain attack. So that occurs when a clot, again, you could see that on that last slide, when that clot or fatty deposits called plaque are in the blood vessel linings, which is blocking the blood supply to the brain. So you have the blood that flows to your heart, you have the blood that flows to your brain. And then your hemorrhage stroke, it occurs when the blood vessel in the brain bursts. So you want to keep those artery walls nice and clean, nice and open, because it's very important for that blood to get to where it needs to be. A stroke can cause significant death, disability, speech difficulties, all sorts of those different things. So if you know someone that has that, personally, my father-in-law actually just had the brain burst. So it all kind of ties into family history, how you the things that you eat, and we'll break it down. So this is going to show you again as well. I think pictures are a great visual, especially when we're sitting here and talking through this. But your area of your deprived the deprived blood that you're getting, where your blood flow cannot flow through, and it causes that bleeding, and you have that that break in your blood vessel in the brain. Heart disease risk factors. Your current body factor, your body facts are going to be those current things that you have going on, which can be your any type of environmental, your weight, and then you have your behavior, and then you have your heredity, your family history. So let's kind of break that down a little bit. Your condition, blood cholesterol levels. So I mentioned this a little bit earlier, and I'm going to kind of really dive into your anatomy lesson here as far as the cholesterol. Blood cholesterol levels from your wellness screening that you went through, or your most recent blood work. I'm going to encourage you to go back, look at your total cholesterol levels. So you have your total cholesterol, your HDL and LDL. Your cholesterol, what that is, it's a waxy substance that's produced by the liver, or it's consumed in certain foods. So when you have too much cholesterol in your body because of diet or what your body produces, and at the rate at which the cholesterol is processed, it's deposited in those arteries. So again, go back to the very, very beginning when we talked about, the straw in your artery walls. So that bad cholesterol, or your LDL, I'm going to jump down to the bottom of the slide here. Your LDL is your bad cholesterol. So the best way that I tell people with this is LDL, lousy. That is the bad cholesterol. So that's your lower density cholesterol, and that cholesterol is the one that increases the risk of your heart disease. So that LDL is actually what is causing that buildup on that artery wall, that plaque. That's the bad stuff. So the higher your LDLs are, the more of that plaque that you have built up in that artery wall. So that's why you want that number to be less. So I'm going to throw out some numbers here for you, and you can write these down or go back and take a look at what your LDL is. But your LDLs, you want that number to be less than 130. The lower that number, even better, because again, that's giving you more of that blood flow through your heart. When we talk about your HDL, your good cholesterol, my little cheat for here is H high, H happy. You want that number to be high. The higher the number, the better that number. Anything 45 and greater is better. Again, the higher the number, the better that number. So my best description for your HDL cholesterol is when you have that artery wall and you have that buildup on your artery wall. The HDL, that good cholesterol, is actually going to come in and it kind of works like a vacuum, and it's going to clean away and take away that bad cholesterol, that buildup on that artery wall. So that's why you want that number to be so high, is because that comes in and that cleans it away. So H, high cholesterol, you want that number to be high. L, low cholesterol, bad cholesterol, you want that number to be low. I'm actually going to go back real quick and talk a little bit about your HDL, LDL cholesterol as well, and just kind of break down some of the different things that can cause that number to go up and down, and it will be in here as well. But your HDL cholesterol, the best thing, and the number, there's two things that you can really do to help increase that HDL cholesterol. It's going to be exercise, and it's going to be eating a lot of fiber in your diet, your fruits, your vegetables, your whole grains. Your LDL cholesterol, what that's coming from is a lot of your higher fat foods. So think trans fat, saturated fats. If you flip around that food label and you take a look at that, those are the numbers that you want to be low. Fast food, fried food, those are the types of foods that is causing that higher fat, and that's causing that LDL to go up. So sorry, kind of got away from myself there, but going into additional conditions that can cause heart disease. High blood pressure. So that's a condition where the pressure in the blood in the artery is too high. Blood pressure is one of those things too. If you go back and look at your screening, that was one reading. So it's really recommended to have multiple readings. So if your blood pressure was high at the wellness screening, definitely follow up with the physician to get that checked out. And they'll probably take it multiple times to determine. High blood pressure, a lot of, stress can cause high blood pressure. Too much sodium in your diet can cause high blood pressure. Another thing that can cause that elevated heart disease is diabetes, type 1 or type 2. Type 1 diabetes is when you have your body doesn't make enough insulin. A lot of the type 1, 2 diabetes is more it's not controlled by your food, where type 2 diabetes is more controlled or resulted from your food and the things that you eat. And then weight. So weight is one of those things where this doesn't even pertain into heart health necessarily, but your weight can make such a difference in so many things. High cholesterol, your diabetes, with your heart health. So our bodies are not designed and function and carry around the excess fat. So when we are overweight or we are carrying that excess fat, it's putting a lot of pressure on our organs. So it's making it harder for our organs to work. And that can cause, when you have all those that pressure sitting on there, that can actually cause things like your heart to slow down and how your heart functions with that blood flow that gets through and whatnot. So I always recommend, if you kind of put that goal of losing 10% of your body fat, it's dramatically going to help in lowering your risk for heart disease, diabetes, high blood pressure. So getting your blood pressure checked, this is just kind of, the first step in controlling your blood pressure. Making sure that you sit with your feet flat. You're not talking when you get your blood pressure checked, making sure that you can Again, multiple readings, considering, taking the average of 3 different readings. If you are a smoker, if you drink lots of caffeine, if you have little to no exercise, you definitely could be at a higher risk of blood pressure for that. A lot of stress can definitely cause blood pressure to go up. The last time I gave this presentation, I had someone ask me, and I think it's a very good question, what if you go to one of those little kiosks at the grocery store, where the manual blood pressure cuffs? Absolutely. I think any reading is going to be a good reading to get taken. Personally, I think the manual blood pressure cuff is going to give you a better and a more accurate reading. But I think if you're just trying to figure out, okay, like kind of monitor it on your own, absolutely go there, keep a log of it, and follow up with your physician when you can on what those reoccurring readings are. Kind of knowing what your blood pressure is. So blood pressure throughout the years has changed quite a bit as to what is normal blood pressure. So normal blood pressure is less than 120 over 80. So that top number less than 120, bottom number less than 180. The top number is going to be your systolic blood pressure, and your bottom number is your diastolic blood pressure. Elevated blood pressure is now anywhere between that top number between 120 and 129, and that bottom number still being less than 80. So if your blood pressure is 122 over 78, it's still going to be considered now as elevated blood pressure. High blood pressure, which is they call stage 1 now, is going to be anywhere with that top number between 130, 139, and that bottom number between 80 to 90. So the recommendations, 10-year heart disease and stroke risk assessment, if less than 10%, lifestyle changes, reassess in 3 to 6 months. If it's higher, lifestyle changes and medication with monthly follow-ups until blood pressure is controlled. High blood pressure, which is that stage 2 blood pressure now, is anything greater than 140 or anything greater than 90. So the recommendations, if your blood pressure is in there, is going to be lifestyle changes. Definitely follow up with your physician. Medication probably at this point would be very highly considered, and monthly follow-up. So if you're familiar with blood pressure and what blood pressure is, that stage 2 used to be like 160 over like 100, 120, that type of range. So it's changed quite a bit. Blood pressure is one of those things throughout my years that I have seen from company to company. One of those things that kind of slowly has been creeping up. So I think that the American Heart Association changing these numbers is not a horrible thing. So have your blood pressure in check, know what your blood pressure is, kind of follow some of these lifestyle changes to lower and monitor your blood pressure. And behavior, so some different things that you could be doing or are doing that could increase your risk for the heart disease. Tobacco use. So if you are a tobacco user, eliminating or starting to cut back on that is something that's totally going to hurt with that heart disease. Poor management of stress. This is a big one right now. This has, with the world kind of shifting, stress management is one of those things that this past year has been significantly on the rise for most individuals. With that stress. So if you have the stress or under a lot of stress, whether it be work related, home related, kids at home, doing school, all of that type of stuff that falls all under that umbrella. If you do not have that proper management for stress, take some time, do some deep breathing, do some meditation, find something that you can do that is a good stress reliever for you, even if it's 5 minutes a day. Doing something that can help reduce and manage that stress. Unhealthy diet. So this is going back to where I spoke earlier in terms of your high saturated fats and cholesterol, because those raise your cholesterol levels. High sodium and salts raise your blood pressure levels. So just really kind of focusing a lot on what are those types of foods that you are eating. if you need to jot down your food for a day and just kind of say, okay, like I am eating a lot of those higher fat foods. And higher fat foods and high sodium foods are a lot of your processed foods too. So if you're going to the grocery store and you're buying a lot of freezer meals, meals that you have to pop in the microwave and warm up, those are processed. So those are naturally going to be higher in those saturated fats, and those are going to be naturally higher in the sodium. So really when you kind of think about your foods, eating a lot of your fiber, I mentioned that earlier. So your fiber is going to be your fruits, your vegetables, your whole grains. I've had a lot of people also mention to me throughout the years when they talk about fats of, oh, like I don't eat peanut butter because it's high in fat. I don't eat avocado or nuts because they're high in fat. They are high in fat. However, those are not going to be your saturated fats. Those are going to be your healthy fats. So your monounsaturated and polyunsaturated fats. Those are the fats that you really want to incorporate in your day. In fact, I usually tell people every single meal, breakfast, lunch, and dinner, you want to have some sort of protein. You want to have some sort of good, healthy carbohydrate. And you also want to have one of your healthy fats. So your healthy fats could be because you prepare your food in your olive oils or your coconut oils. It could be a handful of nuts for a snack. It could be a half of an avocado at breakfast in your meal. It could be a tablespoon of peanut butter with an apple or a banana for a snack. So those are going to be your healthy fats. So yes, that might cause the total fat intake that you have throughout the day to go up, but that's not your bad fat. Those are the fats that you want in your diet every single day. So if you're eating a lot of fast food, if you're eating a lot of fried foods, if you're eating a lot of those processed foods, those are the ones that you really want to kind of take a step back and try to limit in your diet. Another one, lack of physical activity. So for your heart health, the minimum amount of exercise that you need to do for a week is about 150 minutes per week. If you break that down, that's about 30 minutes a day. You need to work your heart out. That is going to be one of the number one things. Exercise, like I mentioned earlier, that's going to increase HDL. That's good cholesterol. That's what you want to be high. HDL is so important because, again, that's going to clean everything out. That's going to help your heart stay healthy. Exercise is going to help with stress. So to kind of go back to that poor management of stress, it's going to help with your blood pressure. It's going to help with if you have weight that you need to lose. It's going to, and again, heart health, diabetes. Exercise is so important for your body. Do not think, if exercise is not something that you are currently doing, do not think like, oh, I need to stop everything that I'm doing. I need to start going to a gym. It does not have to be that. It could be maybe a 5-minute walk here, before work, if you have 10 minutes that you can walk sometime during the day, and another 15 minutes at night to get that 30 minutes a day. It does not need to be anything crazy. You do not have to go outside and start running or get on a treadmill. It does not have to be anything like that. Just get your body moving. It could be outside if you have children, kicking a ball with your children, walking around, something that's getting that heart rate up just a little bit. And then another one here for that behavior is alcohol. So alcohol increases your blood pressure and your triglycerides. So I haven't spoken on triglycerides yet, but triglycerides, it's a lot like your LDLs essentially, except that is the excess fat in your blood, not in those artery walls. So the triglycerides, those go straight into your blood when your body processes those. So again, that is going to, triglycerides is another thing that can cause that heart disease because of the blood flow to your heart. That's going to come from your alcohol and those higher fat foods. Your family history, sometimes you just have those genetic factors that are stuck with you. It's unfortunate, but still, the more that you can do on that behavior aspect is going to lower your risk. If you have family history, don't just throw in the towel and be like, oh, I have family history, I'm done. There's a lot of things that you can still do on your own to help with that. So genetic factors of high blood pressure, high cholesterol, heart disease. Family environment. So think about, when you were a kid, what are some of those bad habits that were passed down from generation to generation? Was your family a meat and potatoes type of person where you ate red meat, white potatoes every single night? Was your family one that was on the go and was going out and getting fast food all the time? Was your family one that was a big time snacker? So, eating a lot of like the pretzels or chips and stuff, out of a bag. So kind of think about that. Some of those habits that maybe were passed down and you're continuing to do now. I know I have 3 little children at home, and I think about that often in the way that I eat, and then I sometimes sit back and I watch how my children eat, and I'm like, oh, I'm passing that habit down to them. So kind of thinking about that and what little tweaks can you make there. And then just unhealthy lifestyle choices, tobacco use. So, are you a tobacco user? How that increases the blood pressure and that heart disease, and just eating a poor diet. Easy. We're all busy. There's everywhere you look, there are fast food restaurants or commercials that pop up that all pull our direction to what's convenient and what's easy. And eating a healthy diet isn't hard. It's just making that choice of what are you going to do, and being prepared for that. So what can you do to today to prevent that heart disease? So if you have not followed up with a physician, I would definitely encourage following up with a physician, sharing your results with your physician, knowing what your cholesterol levels are, your triglyceride levels are, glucose levels are. If it's been a while since your wellness training, or if it's been a while since you've had your last blood work, making sure that you get that done at least once a year. If you do have some of these levels that are a little bit elevated, or maybe you already do currently know that they are elevated, getting them done a little bit more often, sharing those with your doctor. If you noticed at your last blood pressure check that your blood pressure was elevated, getting that checked regularly. I mentioned earlier, yes, you can go to one of those little kiosks, get it checked just to kind of know what that is, and have a good idea. Keep up to date on your yearly physicals to stay up on your health status. And if you don't know what your family history is, figure out and know what that family history is. Eating that balanced diet. So eating low amounts of that saturated fat, cholesterol, salts, zero trans fat. So really, really, really trying to eliminate that as much as you can. I don't expect anyone to walk out after listening to this and saying, okay, I'm done, I'm completely changed. Make those small changes, really kind of take a look at your diet, see where you're at, see where you can make some of those changes. Start slow, start slow. If you're eating fast food all 3 meals a day, or you're hardly eating at all and the only thing that you are eating is fast food, where can you make that initial change and slowly progress there? The more colorful your plate is, the better. So again, those fruits, those vegetables, those whole grains. Watch your weight, mentioned this before, but if you're overweight, you can lower your risk of heart disease just by losing 10 pounds or starting at that 10% of your body weight. Get active, aim for 2 hours and 30 minutes, so that's 150 minutes of aerobic activity each week. Quit tobacco use. So work out, eat healthier, quit smoking, start small. Don't feel like you have to make all those changes right now, one at a time. And then just to kind of wrap up here, keep in mind an unhealthy habit is easy to develop and hard to live with. A healthy habit is harder to develop, but easier to live with. Not able to have you guys live and ask questions with me here, but if you do have any questions, I want to please encourage you, reach out to me directly. I am with Parkview. It's just Parkview Workplace Wellness. My direct email is just amanda.vanwagner, VANWAGNER @parkview.com. So thank you so much for taking the time to sit and listen to me today, and hopefully you took something away with you in regards to heart health, what that cholesterol is, your HDL, LDL. Remember, lower those saturated fats, trans fats, increase that fiber, increase that exercise, and that's going to be one of the #1 things that you can do to help lower that cholesterol and have some good heart health. Thank you so much.